what's happening in the field of myeloma is that this has really turned into a chronic disease, and there is an increasing recognition of the concept of clonal evolution, the idea that a myeloma at diagnosis is very different than a myeloma at third or fourth relapse. This has been coupled to the fact that there has been a significant increase in new drugs that have become available, and not just more drugs in one family, but actually new families of drugs that have become available to patients with multiple myeloma. And so as a result of that, we have made significant improvements in the overall treatment that has translated into improvements in both progression-free survival as well as overall survival. Some of the, I think, take-home messages from a lot of this is that you can now combine several classes of these drugs and actually get an additive, if not synergistic effect at times with these combinations to improve overall survival. There is also evidence that there are some drugs that molecularly target certain chromosomal abnormalities. For example, venetoclax has shown impressive activity specifically in patients with an 11-14 translocation as compared to those that don't. And that, I think, is probably one of the more interesting targeted approaches in the field of myeloma, which lags behind targeted therapy compared to, for example, lung cancer and now even AML.